Hello, and welcome to this webinar, Senior Food Access in the Time of COVID, a webinar on federal and DC food programs for older adults, co-hosted by DC Hunger Solutions, the Capital Area Food Bank, District of Columbia Food Policy Council, the DC Department of Human Services, DC Health, Age Friendly DC, and the Department of Aging and Community Living. I am Nomi Small, and I work as the Communications Associate with DC Hunger Solutions. Before we begin, I want to cover some housekeeping items. We are recording this webinar so it can be shared later. After all the panelists have made their remarks, there will be time for questions and answers. To ask a question, please use the Q&A function on the right side of the WebEx screen. With that, I will pass it off to Beverly Wheeler, Director of DC Hunger Solutions. Thank you.
Good morning. Play a critical role in the District of Columbia. So I want to thank you for joining this webinar to talk about the opportunities we have to support older adults. All of you play an important role, and we want to make sure that we give you enough information to be able to support our older adults. We know that COVID-19 has made the need for food and other support important, particularly for our older adults. They're important, you're important, and so we want to go forward and let you know what there is to do. So the goal of the webinar, as I said, is to give you important updates on federal and local programs, for you to be able to share this information to all of our eligible seniors so that they know what to do. And it's aimed at organizations in the District of Columbia that actually support older adults. It's not an in-depth look. We're doing an overall high level at several of our programs. There'll be information at the end where you can contact us if you need some additional information. So the programs we're going to cover during this webinar are our SNAP program, the Supplemental Nutrition Assistance Program, federal stimulus checks, senior meals, grocery distribution, and other food sources available during COVID-19. I'd now like to turn the conversation over to Gail. Oh, I guess I'm going to tell you a little bit about DC Hunger Solutions. We are part of the Food Research and Action Center. We play an incredible role, and we love our role in making sure that we end hunger in the nation's capital. Gail, now I'll turn it over to you.
DC Hunger Solutions plays in this. Age Friendly DC has been focused on all the social determinants of health that the World Health Organization brought to our attention. And under our particular domain, community support and health services, we have a very, very lively and Get It Done group who are focused on nutrition in DC. This program is an example of what we are attempting to do, which is to connect you, the providers, with the individuals across the city who may be hungry or don't know how to obtain food or need help with that kind of opportunity to be well-nourished and ready to go out the door and or have someone bring resources to them. So I really look forward to hearing your reaction to this. I want to just underscore that we all, every one of us who are involved in this, want your feedback if we're not covering something that you wish we had said, so that we can make sure we can fill in that blank for you and get you able to do what you need to do with your clients. Thank you so much for participating today. I think I'm supposed to know who I'm turning this over to next, and I can't remember. There it is, Brian.
Thank you, Gail. I appreciate it, and thanks everyone for joining. I'm going to run through about 6 different things, and so to kind of, so folks can see where I'm going. I'm going to talk about, first of all, my name is Brian Campbell. I'm with the Department of Human Services, Economic Security Administration. We're the agency which administers the SNAP, the Supplemental Nutrition Assistance Program, as well as some other programs, TANF and medical assistance, specifically in the district. I'm going to talk about 6 things, just to kind of so folks can follow where I'm going. I'm going to talk about the SNAP benefit threshold and kind of what the application requirements. I'm going to talk about the summary of changes to the SNAP program during the time of COVID. I'm going to talk about how to apply for SNAP. I'm going to talk about our online, new online purchasing and procurement for food. I'm going to talk about the EBT card distribution. And then finally, I'm going to talk about the federal stimulus. Next slide, please. This slide gives you kind of an overview of what the thresholds are. First of all, to apply for SNAP benefits in the District of, you need to be a resident of the District of Columbia. After that, there are a series of thresholds, and you see based on family size down the right-hand side, or left-hand side of your screen. When income exceeds those amounts, that generally means that you're no longer eligible, you would not be eligible for SNAP benefits. And you see across the board what the benefit threshold eligibility is for other respective programs which we administer. To give folks an idea, I don't have this slide on here, but the benefit amount for a family of 1, the maximum SNAP benefit would be $194. For a family of 2, $355. And $509 for a family of 3, and it continues to increase as the family size increases. We have a caseload of about 60,000 family, or it's actually moved from 60,000 change to closer to 70,000 families over the last 3 or so months. One thing that we have added to if folks are unsure or wondering whether they should apply, we would certainly encourage people to apply, and we'd have a new screening tool, not unlike what FRAC has, or DC Hunger Solutions, I'm sorry, Beverly. DC Hunger Solutions has it on their site. It's a complimentary tool, so you can kind of go in, poke in high-level things, say, yeah, I probably would be eligible. But again, it's broad, and so we want to make sure that everybody who thinks they may be eligible certainly does apply. And that's at dhs.dc.gov, and we can post that as well. Next page, please. I'm not going to go over this in depth, but these are a summary of some of the changes which have taken place since COVID. Again, we have all the major programs which folks can apply for, but we'll focus on SNAP today. We have tried to push as much as we can in terms of everything which is available in terms of making benefits easier to access during this time, and also continuation of benefits. And so we have had a continuation of benefits, meaning there has been no need to recertify the previous 4 months. We have a request outstanding to FNS right now to see if we can have a continuation of benefits for July, but we have not heard back. You see the midterm things have been waived. I'll talk a little bit how to apply on the next one. Typically, to apply for SNAP, you need to have an interview, and that has been waived, again, through June. We've opened up new ways to submit verifications, but unlike some of the other programs, specifically Medicaid as well as Medicaid, FNS, which is the federal agency which administers or regulates the program, they have still said we need to collect all verifications. So there is that process is still in place. Terminations, while they're allowed, we are not terminating folks unless they move out or notice that they have left. And finally, emergency allotments, which I'll jump to on the next slide, and really underscores why it's important to have folks apply now. So next slide, please. emergency allotments are a fantastic thing which comes in line specifically, I think, with lots of folks who we're talking about right now. Many seniors might not be eligible for the entire grant amount, which is $194, as I said, for a family of one, a household of one, and $355 for a household of two. What we find as we look at data is that because many seniors come in with some sort of income, the amount of SNAP they have is reduced. So what emergency allotments allow for is it provides that right now during this time of crisis, if I would have otherwise been receiving a grant of, say, $45 because I have earnings and the threshold brought me down to $45, the emergency allotment would step up my SNAP allotment all the way up to the maximum allowable allotment. So if I'm a single, that'd be $194. So we have, and I didn't update the slide because we just got notice of it after I made this slide deck, but we had continued to emergency allotments through the month of July, and we will continue to apply for authority to do those as long as we remain in this COVID state of emergency. So again, it really many folks don't apply because they take a look and they might look at the calculator that we would have out and say, well, geez, my benefit might be $30. It's just not worth my time for $30. And so, well, $30 adds up over the course of the year. We want to really remind folks right now that because we do have emergency allotments, it's actually the entire grant amount, which again, in this case is $194 for a household of one and $355 for a household of two. Next slide, please. The other thing we've worked hard to do is try to increase in ways that folks can apply for benefits. Now, traditionally and historically, the District of Columbia, folks would need to come into one of 5 service centers to apply. As we've moved to social distancing and trying to protect both our workers as well as the general public in terms of exposure, we've reduced the number. We've reduced kind of what we offer within our service centers. So we've constricted our service centers, and right now we are open at 8th Street, Congress Heights, and Taylor Street. We have 2 other service centers, both Fort Davis as well as Anacostia, which is at 2100 Martin Luther King Avenue. That one is in fact under renovation right now. So timing-wise, it was nice. It worked out well to close. But we've really reduced our hours and said this is open essentially just for pickup and drop-off of application. But what we've done, we've opened up significant other avenues which we did not have at all open before. Folks can apply online. And you see on the far left of your screen the link to be able to apply online. You walk through it. It's the exact same way one will walk through. And the last one through a paper application. Last week, we also just released what we call the DC Access mobile app, which is available both on Android phone as well as iPhone. And so you can apply for benefits and submit verifications right from your phone. And then finally, recognizing that everybody does not have either comfort or access to technology, we will mail out applications. If someone calls and says, I'd like to apply for benefits, but I don't have online access, I don't have a smartphone, or I'm just simply not comfortable with it, then we are mailing out applications if folks call and request. And again, I didn't put the number on the slide, but we will post as well. It's 727-5355 is the number that works. And I'll maybe ask somebody who's not speaking right now to put that on, or I'll do it when I get done speaking. It can also be, you can do a written request there, but it's better to call. We've staffed up our call center, so we don't have nearly the kind of the wait time that we've historically had with our call center. And right now, because our applications are being turned around really pretty quickly. Next slide, please. Did I skip a slide? Is what one got? Can you go back one, please? No, other way. Okay, go back. Next slide. Thanks. All right. With one thing we are really, really excited about, and this came online, is we applied for a waiver for online purchasing. Now, traditionally, With SNAP, one would need to go into an authorized supermarket or a corner store or whatever and purchase food. We applied for a waiver so we could use online purchasing in the district, so folks who are receiving an on-SNAP could purchase via online. There are 2 vendors right now who in the district who have been authorized by FNS. One is Amazon, the other is Walmart. Walmart didn't have the infrastructure in the District of Columbia to be able to support it, but Amazon did. And so we worked with Amazon, and it's been probably about 6 weeks now, maybe even a little bit longer that we've been up and running with them, and we're getting a good uptick. Now, while SNAP cannot be used to pay for delivery fees, you see down at the 3rd bullet that if orders of made are $25, $35, or $30, $25 or $35 based upon where it's being ordered from in terms of what part of Amazon, then those delivery fees are waived. And if one only has $20 on their SNAP card, that $5 could be augmented through another source, and so you could still take advantage of that online delivery. And again, we're really excited about it. We're also working hard. Next slide, please. But I cut one thing on the slide, but one thing we're also working at is to try to expand beyond Walmart. I'm sorry, beyond Amazon, recognizing that there are folks out there who, frankly, would rather shop, but they continue to receive food from, their local market or farmers market. And so what we're trying to do, we're trying to work on a coalition to get more vendors approved. Although it's a federal process, we don't control it. To get more vendors approved who can support families through online purchasing. Then where we are right now, again, traditionally folks, as you know, for SNAP would need to come in and use what we call an EBT card, electronic benefit transfer, and that's essentially every month the SNAP, or if it's cash assistance, is loaded onto this card. Now, to receive the card, we had 2 service centers, one at 645 H Street and another at 1649 Good Hope Road. When we back in March, Good Hope Road shut down and H Street was reduced in access. But what we did, again, we shifted to 100% mail card issuance, and so folks no longer have to come into our service centers, into one of these distribution centers to receive a card, but rather it's processed and it's mailed out. Now, it does take another 5 to 7 days, but again, it has been, the cards get there, and so folks do not need to leave their home to access their card. So really, right now, have it set up, folks could apply for a card online, and then have it shipped to them, and then order online. So really supporting that social distancing. I have one more slide that I want to touch on very, very briefly, and that's federal stimulus payment. It doesn't really relate to SNAP at all, but want to make sure that every time we're talking, we just kind of put this pitch out there that the federal stimulus payment is $1,200 per adult and another $500 per child. The information you see is on here, and there's lots and lots of folks who can help support that. One place that we've been partnering with is Catholic Charities, because Catholic Charities has authorization from the IRS that they can essentially file it on your behalf and do it virtually. That's all. Thanks very much. I'm sorry I might have gone over a shade. I'll turn it over to Melissa, I think, who can take it from here.
Yes, hi, my name is Melissa Jensen. I am from DC Hunger Solutions, and I work on SNAP and senior outreach. So I'm just going to talk very briefly about some of the resources we offer. We work with the Department of Human Services. I work with Brian quite a bit to help people with their cases and also to help get their applications in a way that's a little easier, especially for seniors. So first of all, you can see here we have a COVID-19 food resources page that covers all federal programs in the district and how they can be accessed during COVID. So I'll put that in the chat as well, but check that out anytime. If a client or a senior has already applied and you have a question about your case, or your client has a question about their case, they should call the Department of Human Services call center, and that number is there again. That's because they'll be able to access that case directly and tell them things like, yes, we're still looking at it. Yes, you've qualified. No, you haven't. But sometimes other issues come up and they aren't able to get answers on, like, they didn't get as many benefits as they expected. They were missing some paperwork, and or just like they got their benefits and now it's suddenly less, things like that. And we can certainly help facilitate those questions. In general, since the application has switched largely to online, you can still get the paper application if you need it. But a lot of people want to do the online application because it's faster, but then they lack some of the confidence with the technology. We are available by phone, and we can talk everyone through the applications and help them fill that out if they lack that confidence. And so our number is there, 202-640-1088, and I will drop that in the chat. It is a voicemail, so they'll leave a message, and we will respond in 1 to 2 business days. It's usually the same day or the next day. But we're calling, answering those, and also any applications or verification documents that need to be mailed, they can also be emailed to us, and we can submit them as well. So again, we're working in partnership with the department. We can't circumvent the department, and we don't want to circumvent the department, but we can help make that process a little bit easier. And so now I'm going to pass it over to Sharanya with the Department of Aging and Community Living.
Hi, everyone. This is Sharanya Sundar. I'm a public health nutritionist at the Department of Aging and Community Living. I'm really excited to share information about our nutrition services with you and hope to provide more seniors with healthy meals. So I wanted to provide a little bit of background about who we are. The Department of Aging and Community Living provides leadership for nutrition programs for older adults throughout the district. And this is to improve their health, address hunger, and to support independence and cognitive functioning. So our role is to ensure quality service for programs which are provided directly through our 6 lead agencies. So this includes Terrific Inc., Iona, Seabury, Ward 5 and 6, and East River Family Strengthening Collaborative, Ward 7 and 8. And the services offered by community partners include the group dining delivered at our 46 current meal sites and wellness centers, and of course this is before COVID. We also provide home-delivered meals, nutrition screening, and counseling, and these are all delivered by our amazing nutritionists at the lead agencies and wellness centers. Our nutritionists work really hard to help seniors who have malnutrition and chronic diseases through nutrition counseling and providing nutrition supplements. And we also have really fun cooking demonstrations and nutrition education. For example, I learned how to make a really delicious veggie-packed pasta bowl, and we had lively discussions on how to eat to manage diabetes, and we debated about how much sugar is in this smoothie. So it's really fun and educational. Next slide. So we have made some changes to our programs due to COVID-19 to ensure safety for our senior clients. So on March 16th, all of our congregate dining sites were converted to meal pickup locations, and the activities were temporarily suspended. Then on March 23rd, we then offered contactless delivery in place of meal pickup locations to further reduce potential exposure to the novel coronavirus. So now seniors are able to enjoy a safe, healthy meal without needing to leave their homes. During this time, we wanted to continue those fun and educational nutrition classes as well as nutrition counseling, so we started providing virtual classes and telehealth. Throughout the past 3 months, our meal delivery has increased by 286%. We've delivered over 450,000 meals to 6,400 seniors, and we continue to add 100 seniors every week. Improving access to nutritious foods for our seniors is especially important now during the COVID-19 pandemic. As we know that food insecurity and nutritional deficiencies have a profound negative impact on our immune system and disease susceptibility. And studies have shown that consumption of nutrient-dense foods diminish oxidative damage, regulate blood sugar levels, and in turn increase our body's ability to protect against diseases like the coronavirus. So to keep that in mind as we work with our vendors at Dutch Mill and Mom's Meal to provide healthful meals for seniors. So the meals provided through our home delivered meals program are available to seniors who are 60 years of age and older and have either attended a congregate meal site within the past year. So even if they've gotten one meal at one of the sites within the past year, they're automatically enrolled. Or if they have not been a previous client, we would provide a nutrition screening, and it's just a 10-question yes or no screening. And the screening is relatively fast, usually It's just a phone call that lasts, 15 to 20 minutes. So in the home delivered meals, we deliver a package of 7 frozen meals along with juice, yogurt, fruit, and whole grain bread once a week. And we also have special dietary options, including pureed, vegetarian, lactate milk. And for individuals who have medical needs, such as a history of kidney disease or heart disease, we can also provide meals through Mom's Meals, which includes a delivery every other week of 14 frozen meals. The other option we have are shelf-stable meals. So this could be a pretty good option for individuals who may not have access to a fridge or freezer, or may need meals right away, as in within the same day, we're able to deliver that to them. So our shelf-stable meals includes a soup or chili, juice, crackers, and shelf-stable milk. So if you have any questions or want more information about the home delivered meal program, you can email us at dacl.coronavirus@dc.gov. So that's an email that I check pretty often, and I'm pretty responsive. So you can feel free to email me at any time. And this gives an idea of what the meals we provide look like as we follow the nutrition standards outlined by the MyPlate. The meals we provide include 1/3 of the recommended daily allowance for nutrients. In addition to the prepared meals, we can provide boxes of produce delivered every other week through Hungry Harvest for DC residents in wards 5, 6, 7, or 8, and who are 60 years or older and enrolled in SNAP or CSFP. We're still taking on some more clients for this program, so if you are interested, you can feel free to email me, and I can connect you with Vivian Grayton, who is the director of this program. In the future, we're hoping to increase produce and grocery delivery to all 8 wards within the year. So for clients who are interested in applying, they can be a senior, 60 years and older living in DC. So they can feel free to call or email us at 202-724-5626 or email dacl@dc.gov. So this phone call goes to our informational referral office, and then the clients will then be contacted by the lead agency and will be provided with a short nutrition screening to determine their eligibility. If the client calls in and they have no access to food or have no support and limited resources, they can call that number and within the day receive 10 shelf-stable meals. So we've received calls from seniors who maybe only have a couple slices of bread left. So we are able to give them their shelf-stable meals within that day. For clients who are not an emergency, will be added within 2 days of approval. So typically the lead agency will do the screening on the clients. They'll send that to me, and then within 2 days they're added to that delivery list. So we try to accommodate all the clients as soon as possible. So along with providing food to meet nutrient needs, we understand that socialization and mental health is an important aspect of quality of life and well-being. And I know that staying at home can really drive anyone crazy. So we do have a call and talk line. This is a really great service where seniors can call and discuss any topic that they like sports and current events, although there's sports going on now, but they can feel free to call us. We have currently over 100 weekly callers. So anyone who's interested in that, you can refer them to this number. It's 202-724-5626. So we have also have virtual nutrition education classes, live cooking demonstrations, and nutrition calls and telehealth to help to provide resources and advice on how to eat during this pandemic. For one example, our lead agency, Iona, has a website with links at aroundtowndc.org. And lastly, I want to point you to another great resource, which is the district's COVID-19 needs hotline at 1-888-349-8323 or gethelpdc.gov for food and essential items. So thank you for your time, and if anyone has questions, feel free to reach out to me or email our dacl.coronavirus@dc.gov. Thank you.
I just want to quickly interrupt before we pass it off to the Capital Area Food Bank. Please direct all questions that you have to the Q&A function in the bottom right of your screen. And also I want to make clear that this recording, as well as the slides, will be made available at a later point. So we will definitely be sharing these going forward. With that, I want to pass it off to the Capital Area Food Bank, to Austin Hicks and Marion Peel.
Okay, thank you. Good morning, everyone. I am Austin Hicks, and I'm proud to work with the Capital Area Food Bank overseeing their work in the district. I'm so pleased to be here with you all. For those of you who may not be familiar with the food bank, we're the largest hunger relief organization working to serve the capital region, including every ward of the district, suburban Maryland, and Northern Virginia. We exist because there are nearly 400,000 people in our region who aren't always sure where their next meal will come from. And as we know, everything is harder when you haven't had enough to eat. Thinking, learning, working, achieving, everything becomes more difficult. We distribute food to a network of 450 plus incredible nonprofit organizations throughout the region. Working with that network, we provide 32 million meals each year into our communities. I have the pleasure of leading the team that manages our partnerships with over 143 DC nonprofit organizations that include wonderful partners like Martha's Table, Food and Friends, Bread for the City, and Urban Outreach, just to name a few. Together with our partners, we distribute over 9 million meals across our city each year. We're continuing to work to get people the food they need to thrive and to do so in ways that are faster, healthier, and more tailored to their individual needs than ever before. So the food bank and the pandemic. In the first few weeks of the pandemic, we experienced a 75% reduction in retail donations, and that has persisted and is expected to continue. This source of food in normal times is responsible for 60% of all of the food we provide to the community. We are filling this gap through resource-intensive direct purchasing at a time when, from the moment of order to receipt, supply chains have been stretched thin. To continue meeting escalating needs amidst the current health risk of the pandemic, the food bank has rapidly modified its operations and began offering food in different locations and formats. Our approach to COVID-19 has 3 phases. Currently, in the response phase that began in March and continues today, we started purchasing significantly more food to supplement limited retail donations. We are participating in regional economic planning. We've moved to a delivery-only model for the safety of our partners and food bank staff. Since March, all partner orders have been delivered free of cost. We've created regional hubs to account for partner closures. A regional hub model was created to fill in regional service gaps. Hubs are existing food bank partners with significant distribution capacity. They are able to serve high volumes of people and have committed to staying open as long as they are receiving food. Emergency boxes. The food bank began creating 25-pound to-go boxes, which contain shelf-stable ingredients to feed a family of 4 for 4 to 5 days for distribution with minimal contact in areas where traditional pantries have shuttered due to the virus. Pop-up pantries. In areas where there is no longer a partner or hub partner to help meet current needs, the food bank is periodically holding pop-up distribution of emergency food boxes to assist those who would ordinarily seek help from a food pantry. These distributions are being held with the assistance of new and non-traditional partners, including local, municipal governments and other nonprofit organizations. Children's meals, to continue serving meals to children who would normally eat them on site at an after-school program. These meals have been switched to grab-and-go style dinners. Senior meals. The food bank has continued to serve boxes of monthly supplemental shelf-stable groceries to 10,000 plus older adults in our service region through a contactless delivery model. In June alone, the food bank distributed over 4 million pounds of food. For context, last year, the food bank distributed this amount over a 4-month period. In DC alone, 1.1 million pounds have been distributed in June. And last year, we distributed a quarter of that in June. The second phase is recovery, and we see this beginning in July and continuing through June of next year. We are evaluating steps to reactivate our partner network, as well as bring internal programming back online. We're also piloting new kinds of partnerships with organizations that offer services like job training, healthcare, and education to address some of the root causes of hunger. The rebuilding phase. In this phase, we are returning to our strategic initiatives and working towards greater equality in our region as our region recovers. I'll share one such innovation. So the issue, many residents in Washington, D.C.'s Ward 8 face barriers to food security, including low availability of affordable retail options, which can result in poor health outcomes. In D.C.'s Ward 8, there are 78,000 residents with only one supermarket. 27% of residents in Ward 8 are food insecure, meaning that at some point in the year, they are unsure where their next meal will come from. Ward 8 has an obesity rate of 34.9%, more than 10% higher than the citywide average. Residents there are also 5 times more likely to die from diabetes than those in Ward 3. The opportunity. While many Ward 8 residents rely on some form of food assistance, most have some dollars in their budgets for food, and the vast majority want to purchase their food. When surveyed, 88% of respondents in Ward 8 expressed interest in buying groceries and prepared meals at affordable prices within easy walking distance of their home, work, or school. The innovation, curbside groceries. Curbside Groceries is a mobile grocery truck bringing groceries for sale to areas experiencing transportation barriers and gaps in accessibility of affordable, healthy food. Presented by the Capital Area Food Bank, Giant Foods, and the A. James and Alice B. Clark Foundation, Curbside Groceries will deliver a full market basket of goods and groceries year-round. The truck will target neighborhoods with few retail grocery options, particularly Washington Highlands, Congress Heights, Fort Stanton, and Anacostia. This initiative is intended to remove transportation barriers, create access to healthy food, and enable healthier diets for all residents. The food bank aims to encourage entrepreneurship in the Ward 8 retail space by collecting and sharing data to prove the value of additional grocery activity there. This project launched in January, but due to COVID, suspended sales in March. We resume in July with the addition of senior shopping hours at several stops. You will now hear from my colleague, Marion Peel, who will share more detail about Capital Area Food Bank's work with older adults.
Good morning, everybody. I'm Marion Barton Peel, and I'm so happy to talk to you about Commodity Supplemental Food Program, or CSSP. CSSP is administered at the federal level by the United States Department of Agriculture. Locally, CSSP is also known as Grocery Plus. Grocery Plus is administered by DC Health and Capital Area Food Bank. Grocery Plus provides between 30 and 35 pounds of mostly shelf-stable food to about 5,400 seniors on a monthly basis. The types of food seniors receive are shelf-stable milk, cheese, cereal, pasta and rice, plant-based protein like peanut butter and beans, canned meat protein, canned fruits, vegetables, and juice. Along with the commodities, we provide nutrition education materials to help seniors prepare foods that they may be unfamiliar with, or we also provide nutrition ed just in case they want to find a new way to prepare a familiar food they're also familiar with. The commodities on the menu for the month are boxed by volunteers along with the nutrition education materials. Seniors are eligible for Grocery Plus if they live in DC, are age 60 and over, and have an income at 130% of poverty. We distribute at 71 Grocery Plus sites. There's at least one Grocery Plus site in each ward in the city. We have 44 residential sites like Paul Lawrence Dunbar Apartments and 24 community sites like EPO PD Green. We distribute boxes directly to about 160 homebound seniors as well. Lastly, we have a walk-in center located at 5601 East Capitol Street Southeast. That's open Monday through Friday. Seniors can go there to pick up their CFSP boxes throughout the month. During COVID, all of our sites were impacted in some way. They either closed or implemented restrictions that made our normal distribution methods impractical. For example, at all residential sites, the use of community rooms and common areas were restricted. So we delivered boxes door to door, maintaining social distancing. Since the pandemic, on a monthly basis, we have distributed 2,264 boxes door to door at residential sites. We also implemented double distribution at our walk-in center and to our homebound seniors. This is where we're allowed to provide the senior with their current month's box and their next month's box at the same time. This saves the senior both time and money and increases capacity for our drivers as well. Some sites simply closed. So DC Health and DC Drivers for Hire entered into a partnership that allowed the food bank to use those drivers for delivery of boxes to over 526 seniors. We also repurposed the food bank's curbside grocery van that Austin just mentioned for even more senior home deliveries. Seniors participating in Grocery Plus are also eligible to participate in the Seniors Farmers Market Nutrition Program, or SFMNP. In DC, SFMNP is marketed as Get Fresh. Through Get Fresh, seniors receive $50 worth of coupons or checks to purchase fresh produce like fruits and vegetables, herbs, and local honey from approved farmers markets during the SFMNP season. And that season is between June 1st and October 31st. Coupons or checks are distributed to seniors from June 1st to September 30th. They are able to use those coupons at farmers markets in DC, Prince George's County, and Montgomery County. We are currently in our enrollment period for Grocery Plus. So for seniors interested in the program, they can call 202-921-7471. They'll leave a message, but we'll return their call quickly to get them enrolled. Also, seniors can go to our walk-in center to apply in person. Lastly, if you are interested in volunteering to pack Grocery Plus boxes or like to deliver Grocery Plus boxes, please contact me at 202-365-3250. Thank you very much.
Hi, good morning, everyone. Thank you for your support of older adults in the district. My name is Tariq Sharif, and I work for the DC Office of Planning and support the DC Food Policy Council. Next slide, please. I would like to thank my colleagues for sharing all this great information. And in addition to all those resources, there are several others that are available for the district residents during COVID-19, which I'll briefly discuss and how to access them. So these are the four you can see in front of you: are free groceries at school meal sites, home-delivered meals and groceries for residents in quarantine, meals for residents experiencing homelessness, and the Produce Plus program. Next slide, please. So our first resource is free groceries distributed at select DCPS school meal sites. Since April, the district has partnered with Martha's Table, DC Central Kitchen, and more recently, Capillary Food Bank to prepare and distribute grocery bags at 13 DCPS meal sites. The grocery bags are distributed weekly at each site and each day, and there are at least 2 grocery sites available. You can see on the slide in front of you the locations for each day and along with the wards that each of the schools are located in. Grocery bags are distributed on a first-come, first-served basis from 12:30 p.m. to 2 p.m. at each site, or as long as supplies last. We have 300 or more bags available at each site each day. Following this webinar, you can find a list of the grocery distribution sites at coronavirus.dc.gov/food. Next slide, please. The district has also launched resources for residents' isolation and self-quarantine at home. So recognizing that it's critical for people who have contracted COVID-19 to isolate and quarantine away from others, the district created a Get Help hotline and online portal to help residents who are in isolation and need help accessing food or other resources provided by local businesses and organizations. So residents who are eligible can receive a week's worth of home delivered meals, which is about 21 meals, or a week's worth of home delivered groceries, which is enough to prepare meals for 7 days. And they may also be eligible to receive home delivered pediatric kits with infant formula diapers, hygiene kits with sanitation and personal supplies, and other resources that they may need at home. In order to access these resources, residents can call 1-888-349-8323 or visit gethelp.dc.gov, and you will be connected with an operator who will help you walk the process. If you work the program online, then you'll be called back within 24 hours to discuss your needs and connect you to any resources that are food or otherwise related, such as Department of Employment Services, SNAP applications, and anything else you may need that you can get everything in one place. The district's worked really hard to make it a simple, easy process. Next slide, please. So one other area I want to touch on is meals for residents experiencing homelessness. And for residents experiencing homelessness, we have shelters that are open 24/7 and continue to provide 3 meals per day for all of our clients. The daily meals for unsheltered individuals are also provided at various distribution points. DHS, Department of Human Services, outreach teams are available for more than 400 meals daily, delivering 400 meals daily to unsheltered individuals directly. And the district has also established isolation and quarantine sites and specialized sites for medically vulnerable populations, which provide meals and temporary housing for those who have contracted COVID-19. And to connect to those resources, you can email dhs.covid19@dc.gov. And you can also find a list of the distribution sites at coronavirus.dc.gov/food. Next slide, please. So DC Greens has also launched the Produce Plus Direct program this year. It is the 2020 version of the Produce Plus program, which operates every year, and it's administered by DC Greens and funded by DC Health. It's been modified this year to operate in response to the in-person challenges presented by COVID-19. The program is free to DC residents and provides locally grown fresh produce in areas of limited access to fresh and healthy food. Enrollment for the program is currently open, and the program itself will begin to operate from July 14th through September 30th. For ease of access and to ensure public health safety, participants will be able to pick up their produce from the same location and vendor all season long. And for more information on this program and to sign up, you can visit dcgreens.org/customers or call 202-888-4834. Next slide, please. And finally, I just wanted to highlight exactly where you can find more information about these additional food resources. The district's created a food resource map with all the school meal sites, grocery distribution sites, meal distribution sites for residents experiencing homelessness, and other food resources on our coronavirus.dc.gov/food webpage. We've also included information for the isolation and quarantine hotline in this slide. And if you have any other questions about how to access food resources or any food resources that are not on this webpage, please let us know and we can highlight them and update our map as we do that on a weekly basis. So please email us directly at dcfoodpolicy@dc.gov. Thank you.
All right, we'll now begin the Q&A, and before we start that, I'm going to go over some questions that I've gotten a couple of times now. First, we will be sending this presentation, including the recording and the slide deck, to everyone who signed up for the webinar, so you will be getting copies of that. In addition to that, we will be sending out a Q&A sheet, so if there's any questions that we don't have time to answer today, they will be covered in that as well. So in addition, if you just keep putting your questions in the Q&A and in the chat, and if we run out of time, we'll make sure it's sent out in that. So the first question I have is for all the panelists can jump in, but let's try not to spend all our time on it because we could. But basically, it's just grocery shopping is really a struggle for seniors right now. They're limited because of going out because of the virus, and then online options can be expensive, and there's only Amazon for SNAP users. And then many lack public transportation. So just how can providers better address this lack of access to groceries and better support seniors with options that work for them?
Don't everybody jump in.
Oh.
Hi, everyone. This is Tariq from the Food Policy Council. So what I can say is that on our webpage, coronavirus.dc.gov/food, there's also a listing of all the other services that are available and special grocery times and stores that are open only for seniors and those who may have comorbidities or pre-existing conditions that could put them at greater risk of contracting COVID-19. So those are all available there. And I know there are a bunch of other programs that we probably haven't highlighted in other organizations that are working in this space as well. And again, those are listed on our website, so you can check in with those for better access. I think we're continually working to solve some of these problems and do our best to address them. So I want to say that while there may not be a ton of options available currently, as you can see in these last couple months, we've been expanding our services and working very hard to connect to those services. So they are coming, and please stay tuned for those and utilize what's available currently.
Thanks, Tariq. And I just want to add to that, for those of you who are older adults or work with older adults, you know these challenges a lot better than a lot of us do. We are working off of what we hear. So if you're seeing the same issues rise up over and over again, reach out to some of these email addresses, reach out to DACL, reach out to the Food Policy Council, DHS, so that the more information we have, the better we can come up with these solutions. This is an unprecedented situation, and unfortunately, a lot of the solutions are to move things online, which aren't always accessible to seniors. So this is something we're all working on, and we really could use your support in that as well. Another question, what access is available in languages other than English for the government programs?
We have all of our languages. We have Spanish and Amharic, which are available both on the app as well as the online form. When folks call in with other language needs, we utilize the language access line, and so can essentially use anything in language it presents. That's what we have. I think we do a pretty good job of it. And if there's challenges, please feel free to reach out directly to me. I mean, sometimes we certainly, when I said we do a good job, there's things we can do better as well, I acknowledge. But generally speaking, Amharic and Spanish.
And I believe this is true for DACL as well. All the government programs have language access lines. Capital Area Food Bank, do you have any programs for languages other than English?
We also have our materials in Spanish as well, and we're looking to get those translated into Chinese because we have a large Chinese population in the 7th and 8th Street area. So we have those as well, and I think we'll try to respond as we see the need rise for other language translation.
Great, thank you, Marion. This isn't necessarily food related, but just is anyone aware of ways that seniors can access programs who lack reliable transportation?
I'm sorry, can you repeat the question? Is the question about how seniors can get transported from point A to point B, or how food can be moved delivered?
I think both. It's just if they don't have reliable transportation, how can they access the programs? If they can't get into a service center, is there a way to get them there, or is there ways to get around that?
So when it comes to DHS, We do not offer transportation. We've tried to move everything online as well as mailing things out. So there's really no reason that you would need to come into a service center to access benefits. When it comes to then purchasing food, the only thing that DHS has is Amazon at this point. I put in the chat, we certainly are trying to get other retailers, and if there's retailers that are interested, and if you shop at them, or senior shop, or anybody, and they'd like to try to get access, please send us an email at dcsnap.retailer@dc.gov. It's in the chat bar to the right.
Thank you, Brian. Anyone else have anything to add to that question? Okay, well, Brian, you're back on. These next questions are about DHS. Can you just repeat how long people will receive emergency benefits and then the status of recertification?
So emergency allotments. So we're getting approved for those on a month-to-month basis. Right now we're approved through July. So if somebody comes in now, then the emergency allotment would apply to July. And we will continue to apply and do everything we can in terms of making a compelling argument or present a compelling case to continue this. But it's the discretion of the Food Nutrition Service whether we get that. And I'm sorry, what was the second question, please?
The recertification, the status on that
waiver. Yeah, sure. So recertification, that's a little more uncertain. I think that right now recertifications extend through June. We have applied for a waiver for July. We have not yet heard, and I know it's the 24th of June right now. So every single state is in the same precarious position where FNS is not granted any sort of waiver for July. So trying to figure out how we're going to make this work, assuming we don't get any sort of waiver. We'll advise all of the families and all the individuals on SNAP, as well as folks on the this advocate community about what we hear from FNS.
Great, thank you, Brian. And I want to reiterate, DHS is doing a great job of doing auto calls about all of these changes in the program. And so if your clients or if you are receiving SNAP, make sure your phone number is up to date with DHS. If you're not sure, call that call center hotline. They'll make sure you're getting all those notifications. And also, seniors, they don't need to do anything to receive those emergency allotments. They are just automatically added onto the card as long as DC qualifies for them. All right, Austin and Marion, Capital Area Food Bank. How do recipients prove that they are financially qualified, and are they turned away if they don't qualify?
Well, for CFSP, participants don't have to prove income. It's a self-declaration, so they tell us what their income is, and we determine if that's within the income guidelines, but they don't have to show any proof.
Great. And then how do the seniors apply for Grocery Plus home delivery and the Get Fresh vouchers?
Get Fresh is part of the program, so that there's no additional application they need to apply for. For home delivery, we need to do a needs assessment because it is based on whether a senior can actually get out or not. So if they're unable to leave their home because they're ill, homebound, we do a needs assessment, and based on that, we'll add them to the homebound delivery list. But of course, we've done a lot more home deliveries in the past couple months because of COVID. So if there's a real need and you're not homebound, we can find a way to get you your box.
Great, thank you. And then Tariq, there was a question that have any of the sites ran out of food that are giving them out, and how can seniors make sure they're getting that if they do run out?
Sure. So we have had a couple sites in the past that have run out before our time. And for those sites, we have increased the number of grocery bags we have available. So we haven't had a large issue with that moving forward. And some of the sites we're doing, I think their biggest one we serve is Columbia Heights Education Campus. And we send upwards of 500 grocery bags to that site. And those are all gone, but we make sure we make it through the full time. So there shouldn't be any issues with running out currently. But if there are, again, please let us know, and we can work to increase those numbers as we're tracking that information.
Great, thank you. And then one last question. We're at time, but I think this is an important one for Brian. As we know, sometimes our seniors are subject to scams. They said that, oh, where did it go? But someone with an active case is getting phone calls saying her food stamps are in danger of being cut off. When calling customer service line, she said her account is still active. Is this a scam that we know about going around for SNAP?
I'm not familiar with that. If you could email me that offline, and anything that you find offline, I'll put my email in the chat, and we'll drill down. I mean, we are not terminating benefits right now, and I'd like to hear about this stuff so we can drill down on it, please. Great.
Okay, that's all the time we have for questions for now. But again, if you email any questions to me and put my email in the chat as well, and we're going to put together that frequently asked questions document that will go out along with the PowerPoint and the recording to everyone who participated. And so any other questions that you have or think of coming up, we can add those to that as well. All right, thank you everyone for attending. We're all here to serve you. We will be sending out a survey quickly after this, and we will really appreciate your feedback on this webinar. And then also within the next week, you'll get the recording, the slides, the frequently asked questions, and then the contacts for all the organizations and agencies who spoke today. So please, all of your questions, let us know. We are really here to serve DC's older adults, and then also those of you who serve them, and really trying to get through this, and then also to provide the best care after the COVID emergency ends, because we know we will be in a changed world. So Beverly or Gail, do you have anything left to say before we sign off?
Yes, thank you. Stay safe and stay healthy, and continue to serve our older adults. Thank you.
I think this has been very valuable. We'd love the feedback. Please fill out the survey afterwards.
Great. Again, thank you everyone. Stay safe and have a wonderful day.